Am I going to be a guinea pig when I participate in one?
You're definitely not a guinea pig on a trial. Well, that is what some people think really, is it like a trial and error thingy, and I walk into clinics and I participate in a trial because the doctor asks me, and then some things will happen to me that I'm not aware of or that I don't want. So certainly that is why it's important to talk about in detail what is the trial about. And yet sometimes it's not just about a treatment, it's about the frequent visits, it's the frequency of scans, it's the frequency of being seen in the hospital, the commitment, the burden of traveling. But sometimes we also ask for biopsies, for instance, which is important because sometimes you need biopsies to make sure a patient is a suitable candidate for a trial. Sometimes you want to find out, you put a patient on a trial, you have a great scientific rationale, you think that treatment must work for that patient, but it doesn't. So getting another biopsy, even after treatment, would be really helpful to understand why did this or that treatment not work appropriately. And that is something patients have to consider. Sometimes those biopsies are mandatory to participate in a particular study. Sometimes they are not compulsory, so you can say yes or no. What do you think about biopsies?
Well, that's another thing I wanted to mention. I'm actually scared to have another biopsy.
Would you mind having blood samples taken?
Okay, that sounds better.
Sounds better, but I'm not making a deal with you. So we clearly tell you what is needed, when do we need to draw what kind of samples, and we will also certainly let you know, do we need another biopsy or not? And that is certainly the case where a patient can say, no, I don't want it. Sometimes patients say, I would do it. But sometimes we doctors in that case have then to say, well, it's not safe to do it. But you still could, for most instances, you can still carry on with the treatment. But yeah, to answer your question, you're definitely not a guinea pig on a trial. So we always have to have a rationale. Why do we want patient A, B, C with that or this kind of cancer with trial treatment A, B, or C? That decision is not taken easily. So we have tumor boards. We have discussions once a week where we discuss all our patients on a waiting list to make the best possible matches for patients, for trials, for the patient's sake and for safety reasons, but certainly also to make the research as meaningful as it can be.
Okay, well, I guess that if there is an option, then I probably would like to take part.
Or at least encourage the doctor to tell you more if you need more information. So always be frank and honest, bring your questions and be sure there's no stupid question to ask.